Hello, dear friends. Today, we will discuss the most effective method of skin rejuvenation, which returns elasticity, increases skin density, reduces the number of fine lines, fights circles under the eyes, eliminates old scars, stretch marks after childbirth, stretch marks after weight gain, and sudden weight loss. It is effective in treating post-surgical scars and scars that remain after acne. The technology in question is the intradermal application of microfat, better known internationally as nanofat. This method utilizes very tiny particles of fat. The changes in the skin are possible because adipose tissue is one of the richest reserves of stem cells inside the body. As a person ages, the number of stem cells in all organs and systems decreases: bone marrow, hair follicles, bones, liver, and any organ. The number of stem cells steadily declines with age. The opposite is true with fat. We can see that older people can become senile. They may have osteoporosis and muscle atrophy, and their organs may not work as well, but they may be good at gaining fat, and the source of fat is also the body's own adipose tissue stem cells. In addition, adipose tissue contains many fibroblasts and fibrocyte precursor cells. There are also a lot of small blood vessels in adipose tissue. There are cells in the walls of blood vessels called pericytes. These are also stem cells. Nanofat technology involves extracting the stromal vascular fat fraction from a person's own fat. The concentration of this stromal vascular fraction contains potent growth factors that stimulate the formation of new blood vessels. It contains stem cells that originate from adipose tissue and vessel walls. Stem cells can transform under external conditions into different cell types and divide. With nanofat technology, this suspension is injected into the problem areas. The stem cells contained in this suspension begin to differentiate into fibroblasts. These, in turn, begin to produce collagen fibers and thus strengthen the skin's framework. Pericyte cells, the cells of blood vessels, do the same. Growth factors, which are contained in the stromal vascular fraction, contribute to better engraftment of these stem cells. This fat suspension or nanofat technology is an offshoot of adipose tissue autotransplantation. For quite some time now, such a direction as liposculpture has been known when, for cosmetic purposes, a certain amount of fat is sucked from the places where there is a lot of fat, for example on the thighs, and transplanted, for example, into the chest. In this way, two effects are achieved. On the one hand, the volume of the thighs is reduced, and on the other hand, the volume of the breasts is increased. Liposculpture, the extraction of the stromal vascular fraction from one's own fat, has become very popular in the last 10 years. Nanofat technology is in great demand in almost all developed countries. Even in the USA, where there are rigid rules and strict regulations of such methods, the use of nanofat technology is considered to have minimal impact on the biological properties of the tissue. In fact, it is a kind of technology of fat transplantation from one place of a person to another. Nanofat technology is appealing because it is affordable and safe as it utilizes a person's own fat. The cells obtained by this technology do not undergo any processing. The clear and pronounced effect lasts a very long time, according to some estimates, to 10 years. The technology is also used to treat baldness. This method causes almost complete rejuvenation of the skin, which cannot be achieved by any other means. Plasmolifting is its semblance, but it is much weaker and does not help everyone. Everything else is mesotherapy and revitalization. You cannot compare Botox with this method because it does not improve the structure of the skin, but only relaxation of the mimic muscles. Hyaluronic acid fillers and threads are not ideal because they give volume but do not change the skin structure. Facelifts also do not modify the skin structure. Technically, the procedure is performed as follows. The patient is put into medically induced sleep and begins fat sampling. As a rule, it is performed in areas with where there is more of it. It can be the area below the navel, on the back of the outer surface of the thighs, or on the inner side of the thighs. It depends on the surgeon's preference and where the patient has more fat. First, a tumescent solution is injected into the fat sampling area. It is needed to liquefy the fatty tissue a bit so that it is easier for the surgeon to recruit the fat. Next, a tube called a cannula is inserted through a small incision. It's a tube with a blunt and windows on the side of it with a cutting edge. With the cannula, the surgeon quickly draws the fat into a syringe. This procedure is essentially similar to liposuction, but you should not expect the same effect as liposuction because only 50 milliliters of material is taken. It is microliposuction. Naturally, the procedure of nanofat can be combined with a large liposuction. So some fat is taken and centrifuged. As a result, the collected material is separated into 3 parts. At the bottom is a pink fluid that contains a tumescent solution and blood. The fat itself, or rather stem cells and vascular fraction, are in the middle. On top are the bursting fat cells, which we call oil, and which really look like an oily liquid. The bottom and top layers are removed. The middle layer is washed, and after obtaining the middle layer of fat, it's fragmented. The point is that when the material is taken away, the pieces of fat are usually about 3 millimeters in diameter, and it is necessary to obtain particles smaller than 400 microns. The resulting fat is sequentially passed through several filters. First, the obtained fat is passed through a filter with a diameter of 2.4 millimeters, then 1.4 millimeters, 1.2 millimeters, and a filter with a diameter of 0.8 millimeters. In this way, the fat is gradually fragmented into small pieces and passed through the final filter, which has pores with a diameter of 400 microns. It is a crucial point. Since fat cells do not pass through this filter, they burst and turn into an emulsion. But stem cells, pieces of blood vessels, fibroblasts, and fibrocytes, pass through this fine sieve perfectly. These cells are the cells of the so-called stromal vascular fraction, which are dissolved in the fat emulsion. In other words, nanofat technology involves obtaining a concentration of stem cells, vascular cells, and fibroblasts in a fat emulsion. After enrichment with stem cells, nanofat is injected into the problem areas. It is the technology. Thank you for your attention. Always for you, Dr. PopMed.